So if I look at procurement objective, I would just break it up into 5 overarching themes. First one, generating financial value, which is both in terms of top line and bottom line growth. Second, I would say is more on the process itself. So again, how you can make the procurement process digital, has the right agility, and then make it easy for the user and the supplier to work with you, basically. Third, I would say is the supplier relationship management in itself, because ultimately suppliers are the backbone. You need to ensure there is security with supply. So you need to have the right SRM process and risk management process in place. Fourth one being that a lot of CPOs are now realizing that they need to be much more closer to the business than they were historically were. And with that in mind, business partnering has becoming more and more important. So they are able to understand the requirements better and then again translate those requirements into the right solution, which is long term. And last but not the least, owning the sustainability agenda. In any organization, if not 80%, but up to 50 to 60% of products and services that get sourced or bought is bought through procurement. So those are the first set of doors that you should be knocking if you want to reduce your carbon footprint or focus on Scope 3 emissions. In recent years, the best part is that procurement has been recognized for the effort and for the value it has delivered to most businesses, especially in the last couple of years with the health crisis that everybody's seen. And from becoming a cost controller, they're truly on the journey to become a trusted advisor. And the best part is that within the CEO's objective or most organization objective, amongst the top 5 priorities, procurement is one of them. So that's kudos to everybody involved. So I would say essentially one of the most common challenges that all life sciences companies are facing is around capacity and security of supply. And then secondly, a lot of that capacity has been diverted towards fighting the pandemic. So again, that is creating a supply constraint in the market. Second thing is on the APIs, excipients, and chemicals themselves, which are the building blocks or raw materials, which again are concentrated in a few regions like India and China. So which again, because of lockdown, COVID-19, a lot of their supply has kind of impacted production processes globally and leading to higher lead times. Then the third thing that I just want to add, which is again sort of a common challenge, is that how procurement needs to be knowledgeable with the new therapies coming into the market. So right from CAR-T, precision medicine, because these come with their own set of challenges, because these are making sort of supply chains and procurement a lot more complex, right from focusing on small molecule-based therapies to sort of large molecules, which are more specialized treatment. So again, this is something that all types of life sciences companies are tackling with. So if I look at big pharma, these tend to be companies with 10 billion plus in revenues. From a procurement standpoint, they are quite matured. They've gone through a few transformations within their operating model. They, in many cases, have the right capabilities, processes, systems, and gone through a fair bit of foundational digitalization, I would say. For them, over the last couple of years, it's been about how do they balance and combat the current security challenges in terms of supply with sort of their futuristic ambitions. So that's a major challenge that they are facing. Secondly, second thing that they are facing is around how they can get more closer to the business, look at some of the untapped value, say for example looking at R&D, being part of discovery and development process of the value chain and how they can add to that. Third value generation that they are focusing on is around digitalization, which obviously would be a focus area, but within their foundational digitalization, what are some of the pillars that they can focus on? So whether it's category management, whether it's supplier relationship management, or is it risk management? So the second client segment would be the mid-size life sciences companies. These are companies with revenues anywhere between 1 to 10 billion. And their priorities differ a lot because there are some CPOs out there who are struggling to get spend influence in the company, deliver some savings, and build a business case for procurement for future. Whereas there are some CPOs who are struggling to get the right capabilities so that they could scale up and standardize their processes. And then again, the third angle being like how they can get the right capabilities and skill set to have an ecosystem that is future-proof, essentially. So those are the three challenges within mid-sized life sciences company. The third segment, I would say, is what we call as small-sized life sciences companies. So they tend to be some of the upcoming biotech companies or other life sciences companies, either in late stage, clinical stage, or sort of early clinical stages. There, the priorities for the CPO is quite different. So they want to focus on how they can expand on their external manufacturing network, how they can get the right sources of supply in time, how they can reduce lead times associated with some of the materials and sort of services that they need. A lot of them have single-sourced deals. So how do they move to a multi-sourcing or like an alternate sourcing type strategy so that their supply is secured? First and foremost, digitalization is a journey. You need to have the right roadmap. You need to define the milestones very, very well. You need to have the right KPIs against which you could measure your performance. Start small, deliver value, and then move on. Then comes user adoption and experience. You need to make sure that whatever digital tool or technology you adopt, you test it with users, they're happy with it, and they're willing to adopt that tool or a technology. The second part I would just want to add to that is when you look at data, you should look at how you can integrate different sources of data in the right manner and then provide a 360-degree view to your user, because that's ultimately going to add a lot more value rather than the user going to multiple places to get that information in. So that should be definitely a big portion of your focus area.